In this section, we will be covering the topic of movement strategy training to overcome movement disorders in people with Parkinson's disease. In this presentation, we would cover the principles of movement strategy and the functional applications of these principles in daily fundamental movements such as getting up from a chair, getting up from the bed, walking, and turning. Why is movement strategy training important? In a systematic review conducted by Dawn and her colleagues in 2012, they found that freezing of gait severity was associated with reduced levels of activity. Freezing of gait is considered one of the most disabling gait disorders in people with Parkinson's. In a systematic review and meta-analysis done to review the effectiveness of physiotherapy interventions on freezing of gait, it suggests for interventions for freezing of gait to start early. What is movement strategy? It is a compensatory strategy by bypassing the defective basal ganglia. Basal ganglia enables automaticity of movement, control of learned movements, and internal cueing of movements. Hence, with a defective basal ganglia, it is important to learn strategies to improve performance through practice. To put it in a simple way, we are all dependent on dopamine, which is produced by basal ganglia to automatically execute movements. However, when there is a lack of dopamine, as depicted in the second circuit, despite having the ability and the intent to move, movement is not executed. Hence, freezing happens. To overcome this lack of automaticity, it has been shown that with 100% attention on task, we are able to connect the loop for movement. The principles of movement strategy can be remembered with the acronym ABCDE. A for advanced planning. Before moving, it is important for people with Parkinson's to prepare themselves by allocating time to plan and mentally rehearse the steps of executing a task. The second is B, for breaking down the task sequence. It is our role as physiotherapists to break down what may seem to be a straightforward movement such as getting up from a chair to simple steps like first tucking heels behind their knees, sitting forward in chair, and finally leaning forward to stand tall. Next, C for cues. Using cues such as visual, auditory, and tactile helps to anchor our attention to the task so that the movement could be executed successfully. D for dual tasking. In order to have 100% attention on the steps of movement, it is important that dual tasks are avoided. And finally, E for environment. In well-lit and clutter-free environment, freezing episodes are reduced as there are less obstacles in the path to distract the attention away from performing a movement. It is important that we educate our patients that improved movements are possible with Parkinson's. For those who have to go through such movement difficulties daily, they are usually convinced that with Parkinson's they no longer would be able to move well, and hence many may unwillingly give up the attempt of mobilizing to reduce the risk of falls. These patients need to be educated that there is an underlying potential for better movement, that it is possible for them to improve their movement, their ability to walk with big normal steps, have louder voice and clearer speech, and even improved swallowing with less episodes of choking. In the next few slides, we would go through some examples of how a movement task could be broken to simple steps. Patients should be educated on the importance of concentrating 100% of their attention on executing each step before proceeding to the next step. They should avoid moving fast and instead focus on performing each step big. In order for movements to be smoothly executed, it is important for people with Parkinson's to pay conscious attention on the task rather than to be distracted by external distractions like talking on the phone or internal thoughts such as fear or worrying of what others may think. Similar to driving a car, we choose the manual control for the execution of each step instead of being in automatic drive. Using cues, as mentioned earlier, helps to anchor our attention to the task. We could teach our patients to internally visualize moving big or cross imaginary lines on the floor when they are walking. Or we could use external visual cues such as taping strips on the floor, or use metronomes for auditory cues, or to mimic the gesture of big movements that makes it easier for them to mirror the movement, and also tactile cueing gadgets that produce a vibration to trigger the timing of the movements. Performing one thing at a time is usually easier said than done. Here, it is equally important to educate the family and caregivers on the importance of avoiding dual tasks. This would mean that they would have to avoid talking to them while walking and even to avoid rushing them to move faster, as this would only further distract the patient, causing them to freeze even more. If family and caregivers are taught the strategies, they could use the cues and calmly redirect the attention of the patient to focus on the task. Let us now watch a video on how we could break down the steps of walking towards a chair, sitting, and then standing from a chair.
I have difficulty getting in and out of a chair. What should I do? How to sit in a chair. Step 1. Walk towards the chair. Step 2. Use the clock face strategy and turn or march to turn. Step 3. Do this until the back of your knees touch the chair. Step 4. Lean forward and bend your knees. Step 5. Sit down slowly. How to stand up from a chair. Step 1. Tuck your feet in under your knees. Step 2. Move to the front of the chair by shifting your weight side to side. Step 3. Lean forward, lift your bottom and stand.
Taking small steps or fascinating is a common presentation amongst people with Parkinson's. We will now watch a video on how to overcome this.
I walk slower and take small steps. How can I take bigger steps? How to take bigger steps. Step 1. Think about taking bigger steps. Step 2. Step over visual or imaginary lines on the floor, landing heel first before toes.
Freezing episodes while walking happens commonly when patient is initiating the first step or approaching a target, or when walking through narrow spaces or having to make turns. The next few videos will show us how to overcome these freezing moments.
When I walk, My feet feel stuck to the floor. What should I do? When I feel my feet stuck to the floor. Step 1. Stop. Stand upright and take a deep breath. Step 2. Shift your weight from side to side. This will free up the weight on the leg taking the first step. Step 3. Think about taking big steps or step over visual or imaginary lines on the floor, landing heel first before toes. I have trouble turning when I walk. What should I do? How to turn when walking. Tip 1. Walk around in an arc. Avoid quick sharp turns. Tip 2. Use the clock face strategy. Tip 3. For narrow spaces, try walking sideways.
Getting in and out of bed may seem effortless to many, but for those with Parkinson's, this could be a big struggle. We would now see how to break the sequence of getting in and out of bed.
I have difficulties getting in and out of bed. What should I do? How to lie on a bed. Step 1. Slowly lower yourself to a seated position. Step 2. Lean on your forearm. Slowly lower onto your side and bring your legs up at the same time. Step 3. Roll onto your back. Keep your knees bent and shift your feet, hips, and shoulders to the middle of the bed. How to get out of bed. Step 1. Bend your knees and put your feet flat on the bed. Step 2. Move yourself to the edge of the bed by shifting your feet, hips, and shoulders. Step 3. Roll to your side. Slide your legs off the bed and push yourself to sit up using your bottom arm.
Take every opportunity to reinforce these strategies. In summary, it is important to break down everyday movements into simple steps and perform each part separately with 100% focus on one movement at a time and avoid multitasking. Prepare in advance for forthcoming movements with mental practice. Use external cues to trigger these movements, and declutter the environment and keep it well lit. We have come to the end of this presentation. Thank you all. Please attempt the case study in the section CE4.